Hi, it's Dr. Ibegbu again. We are placing another Orbera balloon right here at AMG. Orbera is an option for non-surgical weight loss. Our patient is already asleep. She's very comfortable being monitored and everything is great. So now my able assistant, Lindsay, is going to hand me our Orbera balloon. Thank you. So of course I like to lubricate the balloon so it's easy to pass. So that's what the balloon looks like. And thank you, Mike. We're going to insert the balloon to the back of the throat now. So it's a very simple process. It should be. It goes down into the stomach. And then once we're in the stomach, we'll follow up with the endoscope. So this whole process of placement takes approximately 10 to 15 minutes depending on the case. So for those of you out there that are considering a weight loss option, Orbera is an incredible option that is non-surgical, takes 10 minutes to place under anesthesia. As I mentioned, our patient is nice and comfortable. So now Lindsay is beginning to inflate the balloon so you can actually see the inflation. We're using saline for inflation. The amount of volume we use depends on the patient. Everybody's not the same. So actually we can now turn around and see what it looks like in the stomach. So as we get closer to that screen, you'll be able to see that the balloon is being inflated now. And the more saline we add to the balloon, the shape of the balloon comes into play, as you can see very nicely. Really well. So you can come back to me now as we continue to talk about it. So Lindsay is going to keep adding small volumes of saline until I feel comfortable that we are at a volume that is going to be perfect for this particular patient. The balloon is left in place usually for 6 months according to the FDA approval. And patients will experience weight loss usually within the first month. We've seen anywhere from 30 to 100 pounds of weight loss with Orbera. And as we've mentioned many times before, we are still the #1 center for balloon placement all across the southeastern United States of America. So we place more balloons than any other center near us or in the southeast as a whole. So the balloon is taking shape now. We're going to just turn around and look at that again. Shape as we add more volume to it. And what I'm doing now is turning the scope around so we can look at the balloon in the opposite way. It looks great. Everything looking perfect. So that's really the long and short of balloon placement. I'll be done here in another 1 or 2 minutes, and patient will be awake in about 5 minutes. Get ready to go home in another 10 to 15 minutes or so once they're stable. And so call us today. You could be our next Orbera patient, and we are looking forward to seeing you. Thanks for tuning in again.